Hey guys, welcome to this podcast. I'm Dr. Saurabh Bhatia, your host, and today we are with Dave Johnson and Kinoshimaka. And today we are going to talk about the possibility of giving psychological therapy and counseling via text messaging. This is a special case for those patients who do not feel comfortable visiting a therapist or coming on a video call or have difficulty verbalizing their thoughts. And therefore, what we offer is method of text therapy. So let's dive right into it with Dave and Kinoshi.
Okay, so have you heard about this whole text therapy thing?
Yeah, it seems like it's really gaining traction, right?
I mean, it's everywhere you look these days. Like, is this the future of mental health care or what?
Well, that's what we're here to find out.
Right, so we're diving deep into text therapy today. We're going to figure out what it actually is, like beyond just texting your therapist. And we're also going to look at, like, does it actually work?
And who it works for, right? There are so many different ways that people are using it these days.
Totally. And the really cool thing is we've got this great article to guide us. It's called The Role of Text Therapy: Benefits and Best Practices.
Oh, yeah, that one is packed with insights.
It is. Okay, so first things first. What exactly are we talking about when we say text therapy? Because I feel like some people, hey there, want to
Yeah,
share your thoughts on this?
yes. So there are a lot of patients, and especially when I'm talking about India, who feel a little stigmatized if they have to visit a clinic or if they are also taking face-to-face conversation with the therapist. And for them, especially this is with Gen Z, they're much more comfortable writing something on WhatsApp or on a text-based conversation.
Oh, wow, that's a really insightful point.
Yeah, that really speaks to the cultural aspect of it.
Okay, let's unpack this a bit.
What's fascinating here is that you're highlighting how stigma around mental health can be a real barrier to care.
Right. And that for a lot of people, especially younger generations, text is just a much more natural and comfortable way to communicate.
If we connect this to the bigger picture, we can see that text therapy could be a really powerful tool for breaking down some of those barriers.
Absolutely. It makes it so much easier to access mental health care when you can do it from the comfort of your own phone without having to walk into a clinic.
It is really about meeting people where they are, right? And for a lot of people, that's in the digital space.
And it's not just about comfort levels, it's also
Oh, yeah, let's hear it.
Yeah, I just wanted to butt in because I wanted to say that I have given therapy to a lot of adolescents, and they are usually very shy, considering that I am of their parents' age. So sometimes it takes a long time for them to open up in a face-to-face chat. But on text chat, I have found them to be much more to become much more comfortable much earlier, you know?
That's such a valuable perspective, and it really highlights an important point.
yeah, it's like you've actually seen firsthand how text can make a difference.
And it's not just about accessibility, it's also about how comfortable people feel.
Exactly. It makes sense that someone might be more open to talking through text than in person.
So you mentioned how adolescents open up faster via text. That's fascinating.
Yeah, that is really interesting. And it ties into this whole idea of creating a safe and comfortable space.
It's like the perceived anonymity of a screen can actually encourage greater vulnerability.
It's kind of like how some people feel more comfortable sharing things online than in real life.
Right, and that's a huge benefit that text therapy offers.
It really does. And it's not just about age, too.
Oh, of course, there could be so many factors that go into that.
Like people with mobility issues, for instance, that make it hard to get to in-person appointments.
It really does level the playing field in a way.
And then there's also that anonymity we talked about earlier.
That's something that keeps coming up, the comfort of not being face to face.
Some people find it easier to be vulnerable when they're not sitting in front of someone.
It's like they can take their time to think about what they want to say.
And they don't have to worry about feeling awkward or embarrassed.
Just like with a difficult email versus a tough face to face conversation.
Exactly. It's often that same feeling, and that can make all the difference.
Right, especially if someone is dealing with issues they've never told anyone about.
That's so important. The article also touched on how text therapy could be beneficial for people with social anxiety.
It really all comes back to creating a comfortable and safe environment.
Yeah, just making the appointment could be a huge hurdle for someone.
Absolutely. With text therapy, they can. Yep, go on.
Yeah, so about this making this appointment, so what we have also seen is that when we ask patients to say, hey, book an appointment, then there is a certain call to action. And a lot of times there is hesitancy to do this action, which is like, okay, what time, what day will I be able to go? What's my calendar? This and that. While text is a non-live happening thing, you can just text anytime, receive a message, and then there's no pressure to immediately reply back. You can reply back at night. So that way, people find it much easier to take action on the thing that they're facing. And that I think is crucial because we are able to penetrate to the patient this way, reach the patient, which otherwise the patient's own resistance to take action and book a proper appointment will prevent from happening.
That's a really important point you're bringing up.
Yeah, like the whole idea of asynchronous communication.
What's fascinating here is that you're highlighting the reduced pressure of text-based interactions.
Right. It's not like a scheduled appointment that can cause anxiety.
If we connect this to what we were talking about, it can be easier to act when you're ready.
Yeah, like it's not something you have to fit into your schedule.
The way you described it really shows the power of flexibility.
Exactly. And it's like a low pressure way to reach out for help.
It really speaks to how this format can reduce barriers to care.
Totally. And that makes all the difference for a lot of people.
This raises an important question about how patients can make the most of this medium.
Well, let's dig a little deeper and we can talk about this.
Well, the article also emphasizes that response times might vary.
Oh, right. It's not like texting a friend where you get an instant reply.
Exactly. It's not like real-time therapy, it's asynchronous.
Ah, okay. So more like sending an email than.
Hey, yeah, what's up?
Yeah, so I wanted to insist here that the text therapy may not be a continuous chat going on between the patient and the therapist in real time. It is important to realize that if the patient sends me a chat and I'll reply to him like maybe 3 hours later, and then the patient can reply back to me after another 4 hours. So it can be a long drawn conversation going on day after day. So there is no real pressure to share your mood or thoughts right now itself.
Okay, that's a really important clarification. Thanks for bringing that up.
Yeah, it's not just about the convenience of texting, but also the flexibility of the timing.
Right. Like you were saying, it's not always a live back and forth.
What's fascinating here is the self-paced aspect you just mentioned.
It's kind of like having the space to really process your thoughts.
If we connect this to the idea of comfort, that adds another layer.
Yeah, you don't have to feel pressured to respond right away.
That's especially important since therapy can be emotionally demanding.
It really is. It's like you can take your time and come back to it when you're ready.
And if we connect this to our previous point about setting expectations,
Oh, yeah, now it makes even more sense why they mentioned that in the article.
this raises an important point about setting expectations for both the client and therapist.
Okay, so as the client, you need to be okay with those potential delays.
And as a therapist, you have to be upfront about your availability.
Right. Clear communication is key. So is being open and honest.
You're right about your needs and what you're going through.
As a therapist, be responsive and clear with your communication.
Yeah, because tone is hard to convey in text messages.
And that connection is really important, even if it's digital.
It's still a human connection, just happening in a different way.
I really have a new appreciation for text therapy after talking about it.
It's amazing how technology makes healthcare more accessible.
And it's all so new, so it's still evolving, which is exciting. Oh, yeah. Go on.
Yeah, on the point of accessibility, I would also like to mention that 1 hour with a therapist is a fairly expensive deal. And therefore, a lot of patients don't readily book because they also feel that this is a lot of money. But when they are texting, and the text charges are much, much lesser. And therefore, I would say it increases the accessibility by removing the barrier of payment and money.
That's a really crucial point you're bringing up, and it's something we didn't touch on directly.
Yeah, it's like we've been talking about all these ways text therapy breaks down barriers, and cost is another huge one.
What's fascinating here is that you're highlighting the financial burden of traditional therapy, which can definitely limit access.
Right. It's like even if someone wants to get help, the cost can make it impossible.
If we connect this to the big picture, text therapy could be an option for many people who can't afford face-to-face sessions.
Yeah, it's like the reduced cost makes therapy more attainable.
The way you described it really shows the practical benefit of this approach.
Absolutely. It's great that it opens up more options for people who need support.
This really drives home the impact technology can have on healthcare.
Okay, well, now that we've considered the costs, let's bring this conversation to a close.
Yes, and we've really covered a lot of ground today.
We really have. We talked about what text therapy is, the benefits of it, and how to make the most of it.
And we've gotten to hear different points of view too, which makes the discussion that much richer.
Yeah, and we really appreciate you sharing your thoughts along the way.
It's been a very insightful conversation.
So
Thanks
if you're
a lot.
curious,
Yes.
maybe look into text therapy further yourself.
Yeah, you could even give it a try and see if it's right for you.
And if you do, we'd love to hear your experience.
Absolutely. Thanks for joining us today for this deep dive.
And until next time, keep diving deep, and thanks for your interest.
Bye for now.
See ya.
Thank you guys. Thanks for having me.